Okay, let us admit everyone. Take 1 minute to get on board. Okay, hi everyone. Thank you so much for joining us today to hear about how you can get your DNP while staying at Alfred, this new inaugural program the University at Buffalo School of Nursing and Alfred State College are very happy to be partnering with. This is a very new program, so we are testing the waters and working out a few of the kinks, but we wanted to give you a brief introduction of the program so that everyone could have a good idea. This session is being recorded, so please keep yourself on mute the entire time. If you have questions during the presentation, please feel free to use the chat. I'll try to reach them. At the end of the presentation, we will stop the recording and we are happy to stay on the call as long as there are questions to answer really anything about the program or about the University of Buffalo, just to get a sense of there. As I said, this is being recorded, so we will put this up on the University of Buffalo's YouTube page as well as our website, and we will be emailing it to everyone as well. So if you want to refer back to this at a future date, it will be made available to everyone. My name is Tanner Gelatt. I am the Assistant Director for Graduate Recruitment at the University at Buffalo School of Nursing. So I work with all of our graduate programs, our DNPs, our PhDs, and our advanced certificates. I'll be the primary point of contact if you have any questions about the program, for the university stance at least. And then Francine, I'll let you introduce yourself. Oh, Francine, you're a little muted.
Can you hear me?
Yes.
Okay, I had to switch rooms. My Zoom just stopped working, but hi everyone. Thank you for joining us today. Tanner and I are very excited to be presenting this information to you. My name is Dr. Francine Mistretta. I am a clinical assistant professor here at UB in the School of Nursing. I specifically work in the adult gerontology nurse practitioner program. So if you do come to our school, we'll be working very closely together. I am also an adult gerontology nurse practitioner. Again, happy that you're here, and we will move on to the next slide and discuss our program a little bit.
Yep, so we're just going to be first going over a little bit about what a DNP even is, about what the adult gerontology program kind of entails, and then we're going to be going more into specifics about how the Alfred partnership will work, and then I will be going over the admission requirements at the end. Just kind of the layout. So with that, Francine, take it away.
All right, so DNP stands for Doctor of Nursing Practice. This is a clinical doctorate degree, and in the nursing profession, this is a terminal degree. A DNP is a clinician who's trained to assess, diagnose, prescribe, treat, monitor, and collaborate with other healthcare professionals. So that's kind of what the DNP does, to sum it up. We get a lot of questions about the difference between the DNP prepared nurse practitioner and the master's prepared nurse practitioner. On this chart here, we have some of the key points. To start, a DNP is about 3 to 4 years of study on average, where the master's in nursing is about 2 to 3 years of study on average. The DNP, we have our foundations in clinical, teaching, and research. So those 3 areas are what we focus on in our coursework. We have 1,000 hours of clinical in order for our students to graduate. And the master's prepared nurse practitioners, their clinical ranges, but on average, it's about 600 hours. A DNP, interestingly enough, can work independently in New York State after 3,500 hours in a clinical practice setting in certain areas. So this would include primary care, pain management, some of the aesthetics. So certain areas, DNP can work independently without collaborating with a physician. A DNP can also teach at the university level. A master's prepared nurse practitioner cannot work independently in New York State. They must collaborate with an MD, and they cannot teach beyond the bachelor's program. So the DNP opens up a lot more opportunities, not only for clinical practice, but also education opportunities as well, if you are interested in being an academic. The final piece to our DNP, as I mentioned, is research. And a big part of our program is learning to organize and conduct research studies. So again, those three parts, clinical, teaching, and research, make up the DNP. And we do not get all of those parts with the master's. So we'll move on to the next slide. And then what specifically is an AGNP? So AGNP stands for Adult Gerontology Nurse Practitioner. And this is the role is an advanced practice nurse whose practice focuses on caring for the elderly. And you might get different definitions of what is considered elderly. You can technically, you'll be board certified to treat people ages 15 years of age and up. However, you probably would be seeing people 18 years of age and up. And the AGNP, that focus for elderly is really, they changed it. It used to be 65 and up, but now it's 55 and up. So you're focusing on that middle age to older population. And when we think about geriatrics and the nursing role within that field, so geriatrics is another word that means elderly. We really try and focus on what the ANA says here, the process of aging and the protection, promotion, restoration, and optimization of health and functions of our aging population. So as I mentioned, board certified ages 15 years of age and up, but again, that focus will be 55 years of age and up. And then there's extra focus on the aging process and the diseases and symptoms that are really specific to people as they're getting older. The older person is at more risk for dehydration, delirium, different infections, decreased bone density. There's a lot of different cardiac changes and things that happen as we get older. So the AGNP is trained specifically to optimize treatment and promote quality of life for the elderly and handling these specific symptoms as well. Alrighty.
So this is, before we get into kind of the benefits about the program and everything, we wanted to kind of break down what a sample program layout for this program would be. Now, I do want to start by saying this is just a sample program and could change. Please don't take this as gospel that this is exactly what your courses are going to be, but it is a pretty good guide. But things change sometimes, courses get moved around. So it is a pretty good guide for what we'd be working with. The way that this program would work, it would take about 4 years with 3 summer sessions that you would have to do. The credit totals you can all see there. All of the programs at the University at Buffalo, for the DNP focus at least, are all taught in a hybrid format. So that means that there are some courses that are taught online in a synchronous or an asynchronous format. And then there's courses that are taught in person where you would have to physically be with a faculty member. Now, for the adult gerontology program at the University of Buffalo, most of the courses are taught online. So most of our students really don't have to come to campus all that much. In fact, the way that we have this laid out right now, your first your first year would all be completely online. You would not need to come to campus or worry about anything there. Your next 2 semesters, so 5 total, would be online. The first time that you would need to do an in-person course, and again, I'll talk about the in-person in just a second, is going to be your first summer session with this, I believe it's the advanced health assessment. That's correct, right, Francine? Yes. Okay.
Yes.
So that would be the first time that a student, a normal student, would have to come to the University at Buffalo to get their program. Now, beyond that, you're going to be going through the rest of your time here, getting your different clinicals, different practicums for your different research classes for your DNP, because one of the focuses of a DNP program is that you have to do what we call a capstone project. Capstone project is about 2 semesters where you are basically think of it as a slimmed down dissertation that like a PhD would have to do. A dissertation for a PhD can take A year, 2 years can be quite lengthy. A capstone project for a DNP is still going to be very important because you are becoming a doctor, you have to contribute something new, but the scope of a DNP project is going to be much smaller in nature, and it's going to be much more obtainable to complete in 2 semesters. Our faculty work very closely with you to make sure that the question that you ask is good to go. Francine, you went through our program. What was your capstone project in? Or we called it something different back then, but we now call it a capstone project.
So my project was on coordinating care and transitions from an acute care setting back to primary care. And I was looking at hospital readmission risk, comparing a younger population, I think it was ages 40 to 55, and then I looked at over age 55. So we were comparing those 2 groups to see what social determinants of health, what barriers prevented people from having a smooth transition back home, and then ultimately having to go back to the hospital for some reason or another. A lot of it was a secondary infection or lack of support within the home. So again, I compared those 2 populations. And I worked very closely with faculty on that. I actually used one of our faculty's data. So that was a really nice starting point for me.
Oh, fantastic. So, I mean, that's a really good example of kind of something that, a good example of a capstone, because the overarching field is the adult gerontology, but then you get to get really specific on what you're focusing on and what you're looking at. And you have a lot of flexibility with what your capstone project is going to be on. And that happens at the very end of your semester. But this is typically what you look at. I also want to point out the credit totals that you're looking at. I think that a lot of students, when they come from undergrad, they get the impression that they're going to be taking 12 credits their entire time, that 12 to 15 at least, because that's very common for an undergraduate program. The graduate level, it's very different. Most students will switch back and forth throughout their time between full and part-time, because at the graduate level, full-time can be 9 credits. So as you can see here, sometimes a student is part-time, sometimes a student is full-time, a lot of flexibility there. We're very accommodating at the university. We understand that students have things that are going on in their life, not just their work. So there's a lot of flexibility there with the credit totals, but that is kind of one thing that I wanted to point out. And this is a pretty aggressive schedule for our students. This is very common. Really, students at the graduate level, especially at the doctoral level, are not taking many more courses than that. There's just the content of these courses is far more advanced than an undergraduate program, and you're also working while you're in the program. So doing much more than this is pretty unattainable. Francine, I don't know if you have anything you want to add about that before I move on.
I just wanted to make 2 quick points. The 701 course, the State of the Nursing Science, this is really the start of the research course. Well, not the research courses, because you do a couple others, but this is where you're going to start to develop your research question. And we tie it in with 613, which is one of your clinical courses, to maybe give you some ideas of a population or a clinical problem that you've experienced that, maybe we can help you expand on. But the State of the Nursing Science, that's the course where you're really going to develop your question, and you're going to conduct a literature review. And again, you're doing this, side by side with faculty. So it lays the foundation for the rest of your project courses. So yeah, I just wanted to make that point. So you're not just kind of left to your own devices. You've never done this before. I just really want to emphasize that we make sure we get this right with you before you move on to the other courses.
No, that's an absolutely excellent point, because I think a lot of students think that when they hear doctorate, they have to come in with exactly what they're going to be researching. And that's just not true. I mean, really, the only thing that you need to know when you come into a program is what specialty you want to focus on. That's really about it. You certainly can have areas that are of interest to you, but that often changes. I've been at the university for now 3 years. As I said earlier, I work with all of our graduate programs. I don't think that we've ever had, at least in the past 5 years, even before I started, 5 to 10 years, I would say, I don't think that we've ever had a student in any doctoral program come in but thinks they know exactly what they want to research and haven't changed it slightly based off of their coursework. So it's good to have an idea, but by no means do you need to know exactly what you're going to be researching. I mean, this is going to be in your third year that you would start that State of the Nursing Science course. So that's an excellent point. So thank you, Francine, for bringing that up. Anything else before I move on?
No, that was all.
Great. Okay, so let's talk about how this program would work and some of the benefits that you will have as going through the Alfred program. So students would be enrolled at the University of Buffalo as fully matriculated students. You will be part of our program. You'll have access to everything. As the AGNP program is taught in a hybrid format, the majority of courses, as I said earlier, are going to be taught online. So you don't have to worry about most of the courses, but the few in-person courses that will be done will be able to be taught at Alfred State College. You won't have to worry about commuting to Buffalo. You'll be able to do all of your courses there. You won't need to make the drive. You don't have to worry about the snow. I mean, technically, if you live in New York State, even if you're coming from a mile away, you have to worry about the snow, but you're not going to have to worry about driving up the, I think it's the 400 to get to Alfred from, or maybe the 219. I get confused on the streets, but either way, you don't have to worry about making that long commute. While you'll never need to travel to the university, because you're going to be a fully matriculated student, you will have full access to our facilities. The University of Buffalo is one of two flagship schools in the SUNY system, and we are the largest school in the SUNY system. Actually, we're the largest school in New York State. We are a Research One school, so with that, we have access to an insane amount of resources for our students. We have, I live right next door to our med school, which is the largest in New York State. We do collaborations with them. Our research library is top notch. It's absolutely beautiful. If you go online, it looks very Hogwarts-esque with the wood paneling and whatnot. So you'll have access to all of those facilities. Our faculty are excellent in their field. We have a plethora of DNPs and PhDs that teach in the School of Nursing, so you will have full access to that. But you won't need to travel to Buffalo for that. Even if you were to travel to Buffalo, the School of Nursing is, I believe, the largest, or I'm sorry, the smallest unit in the university. So while you're going to be getting these world-renowned massive resources at your hands, the faculty are going to know your names, even if you're a virtual student. At any one time, for all of our graduate programs, we only have about 200 to 225 students enrolled at one time. So our faculty are going to know your names. You'll probably know the assistant dean. You'll probably know the associate dean. You'll probably know the dean. So it's very hands-on. It's very personal. I was nervous when I came to Buffalo for work that I was going to be in this massive institution, and that's just not the case because the School of Nursing is very hands-on and very small. So in addition to not having to travel to Buffalo for your coursework, you also will not have to travel very far for your clinical sites. All of your clinical sites will be, you'll work with the faculty at UB and the faculty at Alfred, and we'll be able to assign your clinical sites at a site located in the southern tier. Now, I will confess, because this partnership is so brand new, I can't give you an exact list of those clinical sites, but you'll go to a variety of different clinical sites that are going to fulfill a certain goal. This program is designed to give you the flexibility to get your doctorate while still staying in the southern tier Alfred area without having to come to Buffalo. As far as the clinical sites, Francine, remind me roughly how many different sites do the AGNP students go to? I'm sorry.
We break our clinical up acute care and primary care. So it really depends on, you do 300 hours of acute care, 300 hours of primary care. So it really depends on where you want to be and the preceptor that you're paired up with, who, how many hours they're able to take a student on for. But usually it's about 150 hours to 300 at each site. ideally. Sometimes we have to break that up a little bit more, but acute care would be in a hospital setting. Primary care would be long-term care facility, outpatient clinic. And then we have some students who have interest in certain specialty areas that they've developed as they've been gaining experience as a nurse and working through our program. So we work really hard to get them a few hours in whatever, specialty area they're interested in. So it depends, I guess, is what I'm saying.
Exactly. And that's perfect. It kind of lends itself to how we run our program. Our program is, we're not looking to make carbon copies of AGNPs. We are trying to make the best clinicians to advance the field of nursing. And with that, you're going to have different interests than your classmates, and you're going to be able to explore those interests with your clinical sites and your projects. So no, it's exact. No one person is going to be exactly the same. And we're very accommodating to our students that need to explore different areas, or maybe they were convinced that they wanted to do adult acute care, and then they got into a primary care setting and they're like, oh no, this is exactly what I want to do. So it kind of lends you that kind of flexibility to explore different things.
I just wanted to add one more piece, Tanner, when you kind of circling back to when you were discussing research and the project, as well as all of our manuscripts and the libraries that we have here. I just want to note that almost all of the manuscripts, the literature that we have, it's available online. So you'll have, as a UB student, a remote UB student, I guess, you'll have access to so much, our library basically at your fingertips online. And we also have a School of Nursing librarian. She, specific to our school, she can work through doing a literature review. She can help with, helping you find the information that you need for whatever your question is, or if you're just trying to look something up for another paper that you have to do, or just anything. So we're very fortunate in that regard too.
Absolutely. And I also want to stress, just because this program is going to be distant doesn't mean that we don't have the capability to support our students in that way. Actually, a lot of our programs that we have are done in a distance format. Our PhD program is done completely at a distance program. Our postmaster's DNP program are completely distance, and our advanced certificates are completely distance. So this is not the first program that we've done where our students are going to be in a distance type setting. We know how to give you the support, and just like Francine said, Amy Lyons is our name. She's our librarian. She's absolutely fantastic, and she is a fantastic resource to use as well. All right, let's move on to the next one. So let's start talking about the actual admission requirements of our programs. So very first, we require a BSN from an accredited institution to do our program. If you're in your BSN program right now, that's fine, but you can apply for the program in your final semester of your BSN program. So whenever that would fall, that's when you're eligible to apply. You have to have an active US RN license. I know that a lot of the students, we deal with RN to BS students, we deal with just straight BS students. So if you don't already have your license, you must pass your board, and you're in a BSN program, that is, you must pass your boards before the start of the fall semester in order to be eligible for our program. We require 3 letters of recommendation, and these should be written by someone with their master's or their doctorate degree. Now, it doesn't have to be a master's or a doctorate in nursing. It can be an MBA, like a chief financial officer of a hospital. It can be a master's of nursing. It can be a PhD. It can be an MD. We're really quite flexible there, but it should be, if possible, written by someone with their master's or doctorate in something. We do require a personal statement. It's about 2 pages. We ask you to answer, I believe it's 4 questions. It's very general. It's nothing too intensive. We require a current resume or CV. Again, nothing too crazy. We do require transcripts from every school you've attended. I'm going to talk more about that in just a second. And we do require 1 year of RN working experience. But again, if you're currently in your BSN program, you just have to work while you're taking your courses. So that's pretty common, and it's totally done. So just know that if you haven't had experience as an RN yet, you'll just need to get that at least your first year in the program. Okay, there we go. So as I said, all transcripts are required. So let's talk about what transcripts we require. This is a university requirement, so I don't have a ton of flexibility here. But in order to calculate an accurate GPA, I'm going to need copies from transcripts from every school that you've attended at the collegiate level. Now, when it comes to unofficial versus official, I have to have official transcripts from where you obtained your BSN or are obtaining your BSN. And if you have any type of master's degree, nurses are tend to have gone to school for something else before they have found nursing, which is perfectly fine. We love that. It kind of adds some spice to the application pool. So if you have a master's, we do need those to be official. And your BSN school, those have to be official. I can work with unofficial transcripts from any other school that you have. However, they do still have to be clear and legible for me to read them. So your even unofficial transcripts do have to have your name on them. They have to have the school's name on them. And if you have a degree from that school, it has to say that a degree was conferred. So for example, if you got an English degree before you went back to school for nursing, I will take an unofficial transcript from wherever you got your English degree, but it has to say that an English degree was conferred. They need to be clear, they need to be legible. Please don't send any screenshots. The way that our system works, it really gets everything kind of gets messed up, and then it just gets confusing and it slows down the process. If there are any questions about unofficial transcripts, I'm always happy to look at them and tell you whether they're good or not. That's no problem there. So in order to apply for our program, what GPA that we look for? If you are currently in a BSN program and do not have an associate's degree in nursing, so you're not already board certified, you must meet a 3.5 nursing GPA and a 3.0 overall GPA. And again, I'll talk more about what the difference between those two GPAs are in a second. If you've graduated from your BSN program, or if you have an associate's degree and are currently in a BSN program, you already have experience as a nurse, you need to meet a 3.0 nursing GPA and a 3.0 overall GPA. So we kind of make up the difference there with the experience. Tanner, myself, I will review all GPAs and talk to you about options moving forward. If you're concerned about your GPA, I'm always happy to look things over and kind of talk about where you can improve, what we're kind of working with, and kind of potentially your viability for the program. So what is the difference between an overall GPA and a nursing GPA? An overall GPA is a combination of all of your credits and quality points average between all of your schools that you've attended. So if you've only gone to one school, that's your GPA. Your final GPA is your overall GPA. If you've gone to 5 different schools, I take the quality points and I take the GPA, and then you're good to go there. Your nursing GPA, on the other hand, is all of your nursing specific courses. So that's going to be anything with, I'm not quite sure what Alfred's code is, but anything with an NU or NURS, whatever their school's nursing specific courses are, plus some liberal arts courses that most nurses have completed. Examples of this are anatomy and physiology 1 and 2, microbiology, chemistry, very, very common things in a nursing program. I have a list of liberal arts courses that I look at. However, we do not require that a student have we don't require that a student have all or technically any of those completed, because the way that we look at it is we require you to have a BSN in nursing. If your BSN program didn't require you to take one of the courses that's on my list, it does no good making you come back and retake those courses. It really just slows down the process. I just don't factor that into the GPA. I don't give you a 0 for it. It's just not built into the equation. The best 2 examples of this are sociology and pharmacology. A lot of nursing programs are going to require their students take a sociology 101 course, but some don't. If you are a practicing nurse, it does no one any good to make a student go back and take a sociology 101 course. That just is a waste of literally everyone's time. The other example of this is pharmacology. Every BSN prepared nurse in the world has had a pharmacology course. However, a lot of nursing programs build it into courses that they call Nursing 1 or Nursing 2. So again, it's not your fault that you didn't have a standalone pharmacology course. We'll just not factor it in. So those are the best two examples of that. So we don't have a list of courses that you must have taken. Big question, is the GRE or the MAT required? A lot of graduate programs require it. We do not. None of our programs at the graduate school for the UB School of Nursing require a GRE or an MAT into admission. So you do not need to worry about it at all. Oh, and with that, sorry, I thought I had one more slide. With that, I am going to stop our sharing. That is my contact information. I'm always happy to chat with students if there are any questions, but I'm going to, give me 1 second. I'm going to stop the recording. If you're watching the recording, there's my contact information. Please feel free to email me or call me, and I'm more than happy to answer anything that you may have. So with that, we're going to stop the recording.